There are two therapies that most doctors have never heard of, but they're quietly revolutionizing how we approach healing. One is a naturally occurring peptide that your body already produces in small amounts, but when concentrated and delivered properly, can accelerate tissue repair at the cellular level. The other uses specific wavelengths of light to energize your cells' powerhouses and reduce inflammation throughout your body. These aren't experimental treatments, they're proven therapies that represent where medicine is heading. Non invasive solutions that enhance everything else you're doing for your health. And they're especially powerful for nerve pain, chronic inflammation, and those hard to heal injuries that seem to resist every treatment. My name is Dr. Andrew Schneider, and I'm a podiatrist here in Houston, Texas, where I've been helping patients overcome chronic foot and ankle pain for over 25 years. Before I continue, please take a moment to like this video, hit the subscribe button, and share with anyone who's been dealing with chronic pain or slow healing. I also want to offer you my complete audio course on regenerative medicine, absolutely free at regmedcourse.com. This comprehensive course reveals everything you need to know about these breakthrough treatments. What excites me most about the treatments we're going to discuss today is how they represent the perfect marriage of cutting-edge science and elegant simplicity. These aren't complex procedures that require surgery or extensive recovery time. They're treatments that work at the most fundamental level, your cells, to optimize your body's natural healing processes. BPC 157 and red light therapy represent the future of medicine. Treatments that are incredibly sophisticated in how they work, but remarkably simple in how they're delivered. You can take BPC 157 as easily as you take a vitamin, and red light therapy feels like sitting in a warm, healing sunshine. But don't let their simplicity fool you. These treatments are backed by extensive research and can produce results that often seem miraculous when conventional medicine has failed. Let me introduce you to one of the most fascinating compounds in regenerative medicine, BPC 157. The name stands for Body Protection Compound, and that tells you everything you need to know about what this peptide does. BPC 157 is actually a peptide that your body naturally produces in your digestive tract. Your stomach lining makes small amounts of this compound to protect and heal the delicate tissues of your gastrointestinal system. But here's what researchers discovered. When you concentrate this peptide and you deliver it systemically, it can promote healing through the entire body. Think of peptides as your body's text messages. They're short chains of amino acids that carry specific instructions to your cells. BPC 157's message is simple but powerful. Heal faster, reduce inflammation, protect healthy tissue. What makes BPC 157 particularly exciting is its versatility. This single compound can reduce inflammation and oxidative stress, speed the healing of tendons and ligaments, support nerve repair, and even improve gut integrity. It's like having a master key that unlocks multiple healing pathways in your body. The research on BPC 157 is remarkable. Studies have shown that it can accelerate the healing of tendons, ligaments, muscles, and even nerves. It promotes the formation of new blood vessels, which improves nutrient delivery to healing tissues. It also has powerful anti-inflammatory effects without suppressing your immune system like traditional anti-inflammatory drugs do. What I love about BPC 157 is how easy it is for patients to use. We use an advanced oral form that's been specially formulated to survive the digestive process and be absorbed effectively into your bloodstream. This is a significant advancement because traditionally, peptides like BPC 157 had to be injected because they would be broken down by stomach acid. But the oral form we use employs a patented delivery system that protects the peptide and ensures it reaches your bloodstream intact. For my patients, this means they can take BPC 157 at home as part of their daily routine. No injections, no office visits for this particular treatment, just a simple oral dose they can take with their morning routine. I often use BPC 157 alongside other regenerative treatments like PRP or shockwave therapy. It's like having a healing accelerator that works 24/7 to optimize your body's repair processes, while the other treatments provide targeted stimulation to specific areas. The safety profile is excellent. BPC 157 is well tolerated by virtually all patients, with no significant side effects reported in the research literature. Patient compliance is outstanding because it's so easy to take and doesn't interfere with daily activities. Now let me tell you about red light therapy, also known as photobiomodulation. This treatment uses specific wavelengths of light, primarily in the red and near infrared spectrum, to stimulate healing at the cellular level. Here's how it works. These specific wavelengths of light can penetrate through your skin and reach your soft tissues. When this light reaches your cells, it's absorbed by the structures called mitochondria, the powerhouses of your cell that produce energy. The light energizes these mitochondria, allowing them to produce more ATP, which is your cell's primary energy currency. When your cells have more energy available, they can perform all their functions more efficiently, including healing and repair. But red light therapy does much more than just energize your cells. It improves circulation by causing blood vessels to dilate, bringing more oxygen and nutrients to tissues while helping to clear away metabolic waste products. It reduces inflammation through multiple pathways, and it can even stimulate the production of collagen, which is essential for tissue repair. What's particularly exciting is that red light therapy can help with conditions that are notoriously difficult to treat, like neuropathy. The improved cellular energy and circulation can help damaged nerves function better and even promote nerve regeneration. Let me describe what red light therapy actually feels like, because many patients are surprised by how pleasant and relaxing it is. During treatment, you'll be positioned comfortably near a panel of LED lights that emit therapeutic wavelengths. The light has a warm, reddish glow, and you'll feel gentle, soothing warmth on your skin. There's no discomfort whatsoever. Most patients find it quite relaxing. Treatment sessions typically last 10 to 20 minutes depending on the area being treated and the specific condition we're addressing. There's no downtime afterwards. You can immediately return to all your normal activities. We often use red light therapy in series, similar to how we might do for shockwave therapy, but it can also be used along other treatments to enhance their effectiveness. The improved cellular energy and circulation from red light therapy can make other regenerative treatments work even better. What's remarkable is that the benefits continue long after the treatment session ends. The improved cellular function can persist for hours or even days, creating a cumulative effect with repeat treatments. Let me tell you about the patients who benefit most from these advanced therapies, because if you're dealing with any of these conditions, BPC 157 and red light therapy can be game changers for you. Diabetic patients with nerve pain often see remarkable improvements with both treatments. Diabetes can damage nerves throughout the body, causing burning or tingling or numbness in the feet or legs. Traditional treatments for diabetic neuropathy are often limited and provide only modest relief. BPC 157 can support nerve repair and reduce the inflammation that contributes to nerve damage. Red light therapy improves circulation and cellular energy in nerve tissue, which can help damaged nerves function better. Together, these treatments can often provide relief where conventional approaches have failed. Athletes with chronic inflammation also respond exceptionally well to these therapies. Whether it's ongoing joint pain, muscle soreness, or inflammatory conditions that interfere with training and performance, both BPC 157 and red light therapy can help reduce inflammation and accelerate recovery. Post-surgical recovery is another area where these treatments shine. Surgery creates controlled trauma to tissues, and the healing process can be slow to sometimes incomplete. BPC 157 can accelerate tissue repair and reduce post-surgical inflammation, while red light therapy can improve circulation and cellular energy in the healing tissues. But you don't have to have a specific medical condition to benefit from these treatments. Anyone looking to boost their natural healing processes and optimize their body's repair mechanisms can benefit from BPC 157 and red light therapy. What makes these treatments powerful is that they can work at the most fundamental levels, your cells. While other treatments might address symptoms or provide temporary relief, BPC 157 and red light therapy actually optimizes your body's healing machinery. Think about it this way. If your body is like a factory that produces healing and repair, most treatments work by bringing in outside materials or temporary fixing problems. BPC 157 and red light therapy work by upgrading the factory itself, making it more efficient, more productive, and better able to handle whatever challenges it faces. This is why these treatments can be effective for such a wide range of conditions. Whether you're dealing with tendon injuries, nerve pain, arthritis, or slow healing wounds, the underlying problem is often the same. Your cells aren't functioning optimally. By addressing the fundamental issue, we can improve outcomes across multiple conditions. One of the most exciting aspects of regenerative medicine is how well different treatments can work together synergistically. BPC 157 and red light therapy complement each other beautifully, and they also enhance the effectiveness of other regenerative treatments. For example, if we're treating chronic Achilles tendonitis with shockwave therapy and PRP, adding BPC 157 and red light therapy can accelerate the healing process and improve the final outcome. The shockwave therapy and PRP provide targeted stimulation and healing factors to the damaged tendon, while BPC 157 and red light therapy optimize the cellular environment for healing throughout the area. This comprehensive approach often produces results that are better than any single treatment could achieve alone. It's like having an orchestra where each instrument contributes to a more beautiful and complete performance. One of the things I love most about these treatments is their excellent safety profiles. BPC 157 is a naturally occurring compound that your body already produces in just smaller quantities. Red light therapy uses wavelengths of lights that are completely safe and non-ionizing. There's no risk of tissue damage like if you may have with other forms of light or radiation. Both treatments are well tolerated by virtually all patients. There's no significant drug interactions with the BPC 157, and red light therapy has no contraindications for most patients. This makes them accessible to people who might not be candidates for other treatments due to medical conditions or medications. The convenience factor is also significant. BPC 157 can be taken at home as part of your daily routine. Red light therapy sessions are comfortable and relaxing with no preparation required and no recovery time needed. There's even a smaller unit you can continue the therapy at home. What we're seeing with BPC 157 and red light therapy represents the future of medicine. Treatments that work with your body's natural healing processes rather than against them, that are safe and well tolerated, and that can be integrated into your daily life. These treatments represent a shift away from the medicate or operate model towards a more sophisticated understanding of how healing actually works. Instead of suppressing symptoms or cutting away damaged tissue, we're optimizing your body's own repair mechanisms. This is personalized medicine at its finest. Treatments that can be tailored to your specific needs and combined with other therapies to create a comprehensive healing plan. As we conclude our regenerative medicine series, I want you to understand that we're living through a revolution in how we approach healing. The treatments we've discussed, shockwave therapy, PRP, DPMX, BPC 157, and red light therapy represents just the beginning of what's possible when we work with your body's natural healing mechanisms rather than against them. These therapies that you haven't heard of, but should have, are already changing lives. They're helping patients avoid surgery, reducing their dependence on medication, and get back to the activities they love. Regenerative medicine is here, and it's ready to help you heal in ways that weren't possible just a few years ago. The question is, are you ready to explore what these treatments can do for you? If you're dealing with chronic pain, slow healing, or conditions that haven't responded to conventional treatments, I encourage you to schedule a regenerative evaluation. We can assess your specific situation and determine which of these treatments might be the most beneficial for you. Please take a moment to like this video and hit the subscribe button. Share the entire series with anyone you know who's been told they have to live with chronic pain or that surgery is their only option. And don't forget to get your free comprehensive audio course on regenerative medicine at www.regmedcourse.com. This course provides detailed information about all the treatments we've discussed and can help you make informed decisions about your health. The future of healing is here, and it's more hopeful than ever. Thanks for joining me on this journey through regenerative medicine, and remember, you don't have to choose between living in pain and undergoing surgery. They're powerful alternatives that might be exactly what you're looking for. Here's to your healing journey. Thanks so much for watching, and have a great day.